One of the benefits of working with the Louisiana Heart Hospital and CCG is they share our philosophy. Ultimately, our goal as family doctors, primary care physicians, is to keep people out of the hospital. And the Heart Hospital is okay with that. They know the importance of preventative medicine. It's just a really great team dynamic that starts with us, continues in the hospital, and comes back to us. And the patient gets just wonderful care that way.
I love the artwork. What the hospital has done is they've recognized it's not just good physicians, good nurses, good technicians, but the environment is healing.
It's an excellent place to practice medicine. The staff is wonderful. The outcome is excellent.
How's your breathing?
I'm breathing pretty good.
We have the highest patient satisfaction rate in the area, and actually one of the highest in the nation. They love the atmosphere, they love the environment, they love the excellent care they get.
We have a staff that wants to be here. The employees that we've had, some that have been here since the heart hospital opened, they really want to see the hospital prosper, and so they really go that extra mile.
The minute I walk through the doors in the hospital, someone's smiling at me and saying good morning. Whether it's the person who's cleaning the floors, the person in the cafeteria, the nursing staff, that's just the way the attitude is around here.
Our model for patient-centered and physician-led is not just a hospital episode, it's for the entire continuum of care. So we care what happens to you after you leave the hospital. We care what happens to you before you stepped in.
CCG sees the importance of integrating physicians out in the community to help treat, educate health and wellness, and if needed, come to our great hospital.
You know, it's the little things. People always tell you it's the PAD, which is paying attention to the details. So when you hear about the heart hospital, you say, man, it's so clean and nice, and you know, everybody's so nice there and everybody's so friendly. It's always patient-centered. The bottom line is what's best for the patient. It may take a few more resources, it may take a little bit more strategizing, but at the end of the day, what is the best thing for the patient?
There are times when we have to pass on difficult news. There are times when we have to make difficult decisions. And those times, it's important that the patient is not alone making that decision. The family is part of the care team.
We try to look at our patients as if they're ours, as if that's our husband, our children, our parent. How would we want them treated? How would we want someone to talk to them and treat them and care for them and have empathy?
The nurses that come here and want to be part of what we have, or the nurses that have that enthusiasm and the love for nursing. Somebody who sits there from the start to finish, holds your hand when you're crying, helps you when you're hurting, sits with the family in good times and in bad. You're constantly there evolving patient care.
201 was there.
The bottom line is we want to do the right thing. At every point we stop and we think, is this the right thing to do for our patients? Is this the right thing for those who are providing care?
I think I'll probably just make myself available when he's going to do the case.
Our physicians want to be leaders, they all want to engage. It's important to them to be involved in decision-making and care decisions and to leading new protocols and evidence-based medicine. And to do that, collaboration is critical.
Thank you.
And respect is also critical.
The idea of getting multiple physicians involved as it relates to complex decisions is the way that it needs to be done. Opinions can be heard, data can be presented, and a collaborative decision could be made.
Working together, you increase the quality of the patient care, and you work as a team. As an individual, you can do so much, but as a team, you can do so much more. That's what's exciting to me. Instead of being a bunch of individuals working hard, you can work as a group to form something that may be better than what we had before.
We're looking at the best interest of the patient. We're all hands on deck here. We all work together. We're all helpful. From top to bottom, we care about our patients.
We only get the top doctors. We don't just open our doors to anybody because we want to keep the quality at number one.
Our physicians are really important to us. We need to have many options for post-acute care, and we need to have many options to keep patients out of coming to the hospital.
We really need those individuals who come to the table with ideas and who have a vested interest in seeing that this place really lives up to its potential.
We always have to make sure that we don't forget why we're there.